And it's also helpful to think about your microbiome as sort of a garden, right? So like if H. pylori is a weed in there, we do want to flourish and nourish the rest of your microbes and elevate them, because the healthy microbes can kind of tamper down some of these other ones. So it might not be as simple as like, taking an antibiotic and having this go away. I think one of the reasons why H. pylori can be a little bit recurrent is we're not necessarily thinking about how do we lift up all our good guys so that we keep that delicate balance in a good place.
In today's video, I had the pleasure of interviewing Molly Pelletier. Molly is a board-certified dietitian and global leader in nutrition for acid reflux, GERD, LPR, IBS, and digestive health. Molly's approach combines cutting-edge GI science with integrative modalities for the most effective nutrition therapy. Her personal struggles with acid reflux and IBS were the catalyst that led her to complete her Bachelor of Science and Master of Science degrees in nutrition science at Boston University. Today, Molly is the founder of Flora Nutrition, which has been recognized as a valuable resource for acid reflux by US News and Reports and New York Weekly. Molly has also been awarded 2023's Women in GI recognition by the World Gastroenterology Organization. Learn more about Molly and Flora Nutrition at the link below in the show notes. In our interview, Molly defined GERD, LPR, and LPR for us. We talked at length about the overlap between endometriosis and reflux, and how popular, commonly prescribed medications like birth control can affect the upper GI tract and contribute to reflux symptoms. Molly also shared her best tips and tricks for managing GERD and reflux, with a special focus on endometriosis. If you haven't already, please give this video a like, share it with a friend, and hit that subscribe button. Now on to the video. Awesome. I am joined today by an incredible resource for information all about and support all about GERD and reflux and LPR. So the theme of our conversation today is all of those things: the GERD, the LPR, reflux, and how it might overlap with endometriosis. So I am joined by Molly. Molly, can we start off with just a brief intro of who you are and what makes you a great person to talk to on this overlap between GERD and reflux and endo?
Thank you so much for having me. I'm excited to be here. So, like you mentioned, I'm a registered dietitian specializing in digestive health, particularly acid reflux, GERD, and LPR. LPR is a condition called laryngopharyngeal reflux. So the reason why I specialize in this is because I have my own personal story with acid reflux. So I struggled with significant reflux, GERD, and IBS for over a decade. And I remember just feeling totally lost. Like there was not a lot of resources back then for support. My doctors didn't really know how to support me. So I basically was the guinea pig. I tried everything. And eventually I was able to wean off of my PPIs. I was on PPIs for a long time. And I was able to overcome my reflux, heal my esophagus, and now I don't struggle with reflux on a daily basis or a weekly basis anymore. Everyone has occasional reflux, so but I no longer have GERD. So I sort of, I went to school, got my master's in nutritional science, became a registered dietitian, and then I created my business, Flora Nutrition, which specializes in acid reflux. So we have our one-on-one counseling, but also the Flora app, and that's where we are today. We really specialize in that kind of root cause, mind-body approach when it comes to reflux.
Yeah, love that. Thanks so much for that introduction. I have to say, I'm very fortunate. I have only ever, experienced, I don't even know what it was, I guess heartburn one time. And I think it was in response to a supplement. Like I think I took too much NAC or something. And I was like, what is this strange sensation? Excuse me. But I know it very well. My husband often complains about it. And my dad had a really bad history with like ulcers and lots of pain up the esophagus. So I'm grateful that that's not something that affects me, but I can imagine it's quite uncomfortable. Could you tease apart what are the differences between like reflux versus GERD versus LPR? Like, is there a difference between the three?
For sure. So reflux is just describing the act of stomach contents moving into the esophagus. And GERD and LPR are two different diagnoses that describe sort of a different set of symptoms. You can have both. You can absolutely have both, but oftentimes people do have one or the other. And more research is showing that there is a large group of people that have both. But when it comes to GERD, this is the more classical type of reflux symptom where we're having heartburn, chest pain. Sometimes people will experience difficulty breathing, difficulty swallowing, pain underneath the rib cage. And that is usually diagnosed via an endoscopy where they take a look at the tissue of the esophagus. On the flip side, LPR, laryngopharyngeal reflux, is a type of reflux where you might not ever have heartburn. And so this is a really sneaky type of reflux where you may have never identified your symptoms as reflux, but these symptoms are more so respiratory and throat-based symptoms. So difficulty breathing, throat clearing is a big one, coughing, postnasal drip, and voice changes, throat pain, soreness. I know I'm forgetting a few, but just to name a few, those are sneaky. They're often called silent reflux symptoms because we may not identify those as reflux. So sometimes we do pick up these, or sometimes people get an endoscopy or a laryngoscopy and they'll see reflux and they've never had heartburn. So it can be a really kind of sneaky diagnosis.
I have a lot of endometriosis patients who are diagnosed with silent reflux. So is silent reflux does it always fall under that umbrella of LPR? Or can you have like silent GERD?
So silent reflux, LPR, is typically it's diagnosed off a laryngoscopy or symptoms. So if someone doesn't have erosive reflux, like they've had an endoscopy and there's no erosions in the esophagus, but there may be some signs of reflux and they have those LPR type symptoms, they might be diagnosed with silent reflux. But when it comes to understanding the difference between the two, one really important thing to note is that the LPR symptoms are actually not necessarily driven by acidic reflux. They may be driven by an enzyme called pepsin. So pepsin is an enzyme that can travel up with your stomach contents when they move into the esophagus. And that enzyme pepsin can burrow into the tissues of the esophagus and the throat and kind of hang out there a little bit longer. So this could happen on one reflux event or several reflux events. It doesn't necessarily mean this person is having repeated acidic reflux. It could have happened, they have now pepsin bound or tissue bound pepsin in their esophagus. And so the treatment approach is a little bit different depending on the symptoms. Does that answer your question?
Yeah, really interesting, super fascinating. Surprisingly, I actually do encounter a lot of patients with endo who also have these types of symptoms. So I was really excited to chat with you because there must be some kind of overlap. And that's really kind of the next question I have for you. We know, I know you mentioned, before we got on the recording that you have some pretty good working knowledge of endo. And we know that there is that sort of estrogen dependent nature of it. There's a lot of overlap with autoimmunity and also just that like immune dysfunction component with endometriosis and nervous system involvement. Now there's more and more research coming out about like visceral hypersensitivity and how cortisol and stress plays a role in symptom presentation in endometriosis patients. So I know that this is a big question and I don't expect you to answer it, comprehensively as best as you can, but I'm super curious if we can kind of break apart what are some of these overlaps maybe between endometriosis and, I don't know, should I just call it GERD or like, is there a name
You can call
that
it reflux
Okay,
disorders. Yeah,
perfect.
they're
Yeah.
both two types of reflux disorders, and you're so right. There's a lot of overlap here. And
Yeah.
I think also just because IBS is often kind of misdiagnosed when it's really endo, and there's a lot of people with both IBS and reflux disorders. So one of the reasons for this is the altered motility. So, slower digestion, bloating, constipation, these things 100% worsen reflux and really, really common in endo population. We're also seeing that visceral hypersensitivity side of things, being in pain for an extended amount of time, that can impact our gut-brain axis and make the nerves of our esophagus hypersensitive. So That may mean people also may have a condition called reflux hypersensitivity, which I didn't necessarily get into. It's another diagnosis where you may have normal levels of reflux, but you feel this much, much more intensely than anyone else. So you may feel this reflux sensation. I mentioned everyone has reflux. Like, this is a normal part of life, and a lot of us don't feel it. But if you have reflux hypersensitivity, even small movements of reflux upwards can feel really intense. And also, things moving down, like when you're eating, drinking water, your esophagus is so sensitive. This condition is also called esophageal hypersensitivity. So your esophagus is so sensitive, even just eating or drinking can feel like reflux, but it's actually not. So this is when we're kind of looking at doing some pH impedance testing, looking at, is this true reflux or is this hypersensitivity? Because it's a different treatment plan. We might be focusing more on gut-brain axis, but definitely there's an overlap with inflammation as well, and immune dysregulation in both GERD and Endo. So these are things that we would definitely want to be focusing on through nutrition, through our lifestyle habits to reduce inflammation and support immune health. And then in terms of constipation, I already mentioned that, but I want to just circle back because it's so important. If someone is very constipated, that is increasing pressure on their gastric system. And anything that increases pressure on the GI system can loosen a muscle called the lower esophageal sphincter that is supposed to keep your stomach contents in your stomach and out of your esophagus and kind of protect from reflux. But if you're super backed up, it creates this pressure imbalance, and it can be a really big driver of reflux.
What about hormonally? I know that there's a couple of hormones, progesterone, especially estrogen. I know progesterone, and correct me if I'm wrong, Molly, but I know that it can really act on that sphincter there, that
Yes.
lower esophageal sphincter. And we know that there's a lot of progesterone resistance and deficiency in endometriosis patients, as well as estrogen dominance. I mean, I don't see it in every single person that I work with who has endometriosis, but we know that it's sort of part of the nature of the disease. So what can you say about hormones and how they play a role in reflux?
When our hormones are shifting, maybe the week before our cycle, for example, this can loosen that sphincter temporarily. So, with a lot of my clients, even those without endo, we are seeing an increase in reflux before their cycle. And those with endo, we may be also seeing this as well. If there is that hormone imbalance going on, this can be even more drastic where they're seeing maybe they only have reflux symptoms before their cycle. I definitely hear that with my clients with endometriosis, and then they may feel better the week after. So we are sort of shifting, our nutrition a little bit, maybe eating an earlier dinner, using alginate therapy. Alginate is a type of algae that can actually sit at the top of the stomach and protect the esophagus. So we might be using that more during this time. But we're also thinking about like just overall gut health, right? Because we want to try to support our body with support our gut microbiome with everything that it needs to help us with this hormonal regulation. So certain bacterial species may support this estrogen conversion. And so we want to be thinking about getting adequate fiber as well to support our gut microbiome, and then also to support our motility, adequate hydration and minerals and movement, all of these foundational things so that we can kind of minimize how these hormonal fluctuations impact us. We also see this with pregnancy too, with those hormone fluctuations. There's so many reasons why reflux is more common in pregnancy, but one of those reasons is our hormone fluctuations. And our microbiome actually has an estrobolome, which helps us to process estrogen. So it's a really important part of both GERD and endo care is focusing on the microbiome health.
I love talking to dietitians because they're always so, well-rounded in their approach, right? It's not ever just focusing on like one specific thing. They're always bringing in like the diet and the gut and the hormones. I love that. I love that you brought that into the conversation. Um, Anecdotally, I mean, you are the expert in the reflux GERD space for sure, but anecdotally, I've seen a lot of like working on the large intestine microbiome. So if we know that there's a history with antibiotics, if we know that they've had a history with chronic loose stools, diarrhea, or conversely chronic constipation, like something, or urgency or abdominal cramping that's like very, very chronic in nature, I just kind of safely assume that there's probably something going on in the large intestine microbiome, especially if there's a history with antibiotics, right? Repeat rounds of antibiotics. So I have found that working on that microbiome with prebiotic fibers, with tweaks in the diet and the lifestyle, motility support, I found that to be really effective often for helping to improve the upper GI symptoms, which I think you've already kind of alluded to, right, as being helpful. Gluten removal as well. And I'd be super curious about your thoughts on that. I imagine like there's obviously a lot of nuance here, and this isn't a strategy that probably every single person should employ, but I'm curious your thoughts on gluten removal. Do you see this being an effective strategy? Is this a difficult question to answer?
It's a great question, and it's one I get a lot from our clients. From a purely GERD and LPR perspective, gluten is not a reflux trigger. However, we do see certain people coming to us that may have non-celiac gluten sensitivity, or they may have fructan sensitivity, which is the FODMAP that's found in wheat. We also see clients who may have received a elevated zonulin result on some sort of functional testing, whether that's done through our practice or another practice. And in that scenario, we may be doing, low gluten or gluten removal type temporary period to kind of assist with sealing and strengthening the gut lining if someone has an intestinal permeability issue or high zonulin. But in theory, it's not something that we do automatically. Like we would never just blanket recommend taking out gluten unless there was a real need for that. But I'd be curious to hear on your perspective just from endometriosis.
Yeah, and I agree. It's not something like before I investigate anything else or do any other investigation, I'll kind of throw that out there. I've just anecdotally seen that it seems to help a lot of people with the upper GI symptoms. It's not something that will help every single person I work with GI symptoms, upper GI symptoms specifically, but I'm not sure. I think what you were alluding to is probably the same reason. Like maybe they've got some leaky gut, and my understanding from the literature I've read is that the gluten protein, oh my gosh, I can't speak. The gluten protein can increase the gaps, between the cells that line the gut, and that might be part of the reason why they're inflamed. And maybe that inflammation has something to do with why symptoms are presenting. I mean, the few cases that I'm thinking, they were very, very complex, and they had a ton of other stuff going on. There was a lot of blood sugar dysregulation. There was small intestinal bacterial overgrowth. So it's hard to say exactly why. Probably inflammation. And then we do know that there's like a little bit more literature in the endo space showing that removing the gluten does help with pain symptoms. So I would assume it's inflammation related. So maybe it's just taking a little bit of that inflammatory load off, and maybe that's why it's helping with the upper GI symptoms. I'm not exactly sure, but it's definitely one of the strategies that I'll employ much less often for sure. The other thing I'm curious about is Helicobacter pylori. We hear a lot about Helicobacter pylori in social media, in academic literature. Do you see that being the source of upper GI symptoms often?
Absolutely. So that's something that will be tested for if you have an endoscopy. And usually that's the GI doctor's first line of defense. If you are struggling with persistent reflux, is like, well, let's go in, let's take a look, and you should be tested for H. pylori in a biopsy and an endoscopy. But we might also do like a stool test if you are not able to access that, or if you, for some reason, just had one, we want to retest. H. pylori definitely can bring about symptoms of reflux, and even a little bit more sneaky symptoms of reflux, like nausea and burping, we do see frequently also. The interesting thing about H. pylori is that it can increase stomach acid production initially in the infection, but then longer term, we may see this resulting in lowered stomach acid. So it is one of those things where we want to catch it. We want to try to prevent the growth of this. And It's also helpful to think about your microbiome as sort of a garden, right? So like if H. pylori is a weed in there, we do want to flourish and nourish the rest of your microbes and elevate them, because the healthy microbes can kind of tamper down some of these other ones. So it might not be as simple as like, taking an antibiotic and having this go away. I think one of the reasons why H. pylori can be a little bit recurrent is we're not necessarily thinking about how do we lift up all our good guys so that we keep that delicate balance in a good place.
I totally agree with that. I was curious what kind of camp you fall into, because I know that there are practitioners that want to just completely wipe the H. pylori away, even if a small amount is detected. Um, I can't remember which podcast it was, but I have sort of a short list of podcasts that I really enjoy. They host a lot of like experts, whether they're doing research in the space or authors or whatever it might be. And there was one podcast, and I'd have to look back and remind myself which one it was, but it was a trained scientist who was working in the reflux space. And basically he was saying that, there's like this epidemic right now of people mass treating H. pylori, but we know that it can be protective for other pathogenic overgrowths, and it can help with hunger and satiety cues. And so, because it's a source that I trust, I kind of stopped falling into the camp of like mass treating if I didn't think that the person was symptomatic and if very, very low levels were detected on testing. But I'm curious about your opinion.
Yeah. So it depends on the person and what
Yeah.
else comes up on their testing. Like it depends on kind of if everything else is negative, but we're still seeing these kind of reflux, burping, bloating type symptoms, we may. But the thing with our clients with GERD and LPR is they often don't tolerate these things anyways. Like they often are not going to tolerate a really intense antimicrobial protocol. So we might be doing things a little bit more gentle, a little bit more longer term. And the goal is really not to like decimate a certain strain or anything like that, because we can't necessarily target exactly just H. pylori when we are treating, but um, the goal would be to reduce the overgrowth and then again uplift healthy bacteria to keep this at bay. So it really does depend. Like I think if it came up on the GI map and if it's still not elevated, we might end up doing a protocol for it if that looks like the main concern. But if there's like high zonulin, there's like everything else kind of that we want to address, we might address those things first.
Yeah, and I totally agree. I think I would take the exact same approach as well. So that's great. That's great to hear. Okay, this might be a bit of a curveball, although I don't think it would be because I know you're very, very well versed in this space. But there's like a couple of specific medications you'll see being prescribed on kind of on repeat in people with endometriosis, like birth control, hormonal suppressants, maybe some antidepressants. Um, any connection there with these medications and how they might affect the reflux symptoms?
Yeah, so starting with birth control, oral contraceptives, we might see certain nutrient deficiencies that could be contributing to either they may already be on a PPI too, and like the PPI can result in nutrient deficiencies. So then when we're also taking an oral contraceptive, we may want to be thinking about our B vitamins, because if those are depleted, that can play an important role in digestion. And then when it comes to, I don't know if you mentioned this one because this is an over-the-counter medication, but things like NSAIDs, if we're always taking NSAIDs because we're in lots of pain, that can definitely irritate gut lining, can be a increased risk of gastritis, which is very common in the reflux scenario as well. And then when it comes to certain things like antidepressants, and this is not to say that we're against this at all, because when you need medications, you absolutely need them. But we do want to kind of just have that conversation with the doctor if you are more reflux prone, if you feel like you've struggled with reflux in the past, if you have been diagnosed with a hiatal hernia, if you have GERD or LPR in your family history, I would just let them know, because certain medications might increase the risk of reflux. So letting them know that so that they can help you choose a medication or choose an antidepressant that does not increase the risk of reflux would be a really important conversation. And then when it comes to, hormonal suppressants, we already discussed the importance of your hormonal balance on your digestive system. These hormones actually can bind to receptors on your digestive system, and that can stimulate motility. So with hormone blockers, we may see changes in motility. And similarly with, I don't know if hormone replacement therapy is something that you frequently see. It may not be on all that as common as like the hormone blockers, but that can also cause those fluctuations that may loosen the sphincter. So things we just want to keep an eye on, like timing of the medications, how you're feeling when you start, and keep the conversation open with your doctor if we need to adjust.
Yeah, love that. And I do think that, like, I'm happy about this. I'm seeing more and more doctors prescribing bioidentical progesterone to women with endometriosis, which I think is fantastic. But as we've already established, we know that it has the potential to act on the lower esophageal sphincter. So I do hear some people commenting that, yeah, I feel like I'm a bit more constipated, or I'm getting a little bit more upper GI symptoms with the use of the hormone replacement. So that's another thing that might be, relevant for people with endo to just kind of keep in mind. If you do start taking a bioidentical progesterone and you start experiencing these changes in your upper GI symptoms or in your bowel routine, for example, then it might be one of the effects of the progesterone. Okay, this is sort of a broad question. So let's say you're somebody with endo, you're dealing with this chronic inflammation. There's some hormonal involvement for sure, right? Maybe you're kind of hitting that characteristic symptom picture. You got a lot of those estrogen excess symptoms. You got the progesterone deficiency. Maybe you're seeing that present in like spotting before your period or subfertility or something like that. And then on top of that, you've got some nutrient gaps. Maybe your zinc is low. Maybe your vitamin D is low. Magnesium is low. What would some of like your top, and then you're also dealing with some upper GI symptoms, some reflux. What would your like top 3, 4, 5 suggestions for next steps look like? I know, super vague.
I definitely think it's a good place to just start with nutrition, and it doesn't have to be like an all or nothing mindset when it comes to like the reflux triggers. I'd love to have a conversation with this person and ask like, what have you noticed increases your symptoms? Because it can get really stressful when you're already dealing with all of these health issues to then be like, okay, now I can't eat garlic, onions, lemon, any vinegar, citrus, alcohol, caffeine. Like it's a big list to remove. So we might just remove some of the heaviest hitters if you're like, yeah, caffeine every single time I have a cup of coffee, I'm getting heartburn, or I notice with garlic, it gives me the worst heartburn. Like we might do some switches and some swaps and try to work to identify your personal triggers. Also understanding that your triggers may not be food when it comes to reflux. So people always immediately think of reflux trigger, it must be a food I ate, but it actually can be like our meal speed, how quickly we're eating that meal. Eating too quickly is a big reflux trigger. So by slowing down, chewing well, this can really significantly reduce the risk of reflux. We'd also want to be thinking about your meal timing. So if someone is eating their largest meal for dinner, or they're eating a really big meal late at night, this is a recipe for reflux as well. So you don't even have to overhaul your whole diet. Maybe it's just shifting the timing a little bit to be more reflux friendly. And we'd also want to think about reflux soothing anti-inflammatory foods. So this is going to help from an endo perspective, hormone perspective, intestinal permeability, and reflux, to just think, okay, what do I need to add to my diet to help soothe, reduce inflammation, and prevent reflux as well. So we'd be thinking about, lots of alkaline vegetables, fruits, lean proteins, whole grains, anti-inflammatory fresh herbs, maybe ginger, turmeric, things like that. So that making sure we're getting enough of those phytonutrients and antioxidants to reduce inflammation. And this can really help with reflux as well. Just getting enough fiber to like bind to acid and help with regular bowel movements is also super powerful. And that mindset of like, what can I add, is so much healthier than, okay, this is my list of foods and I I can't eat any of this. When we focus on that no list, sometimes we can't even think of what we should be eating. So focusing on addition, I think, is really useful. In addition to nutrition, meal timing, mealtime hygiene, which mealtime hygiene is that slowing down and the ritual of the meal, we're also 100% thinking about sleep and stress. Like these, I call them the unsexy basics, these foundational things. Getting your sleep dialed in, your circadian rhythm, that can do wonders from a hormone perspective, but also esophageal hypersensitivity. Your sleep is really connected, we know from research, to the hypersensitivity of the esophagus. And we don't want that to be hypersensitive because it can lead to a lot of unnecessary symptoms. So dialing that in, and then stress too, right? Like stress can increase inflammation. It can actually loosen the lower esophageal sphincter too. So we want to be thinking about how are we managing stress in our day-to-day life, and what does my morning routine look like? What does evening routine look like, so that we are optimized, because we can never eliminate stress. We're always going to have stress. It's really just about how are we managing this on a day-to-day basis.
Yeah, love it. And totally agree. 100%. So it sounds like all the same foundational, I wouldn't even call them basics, like they're pretty significant, but all the same sort of foundational pieces that I would address with somebody for the endo symptoms, the endo related pain, sounds like they're the same, and they'll work for both. So check, both for upper GI as well as endo symptoms. I was going to ask you, and I totally agree. I'm big on, let's see what we can add in more of versus pull out. I'm really not a big fan of that mentality. And I really try and, encourage people to diversify the diet over pulling things out. And I totally get it with endo. Like if you're living with chronic debilitating pain, it seems like a small sacrifice to make, right? For a little bit of symptom relief to just pull something out of your diet. I totally get it. But I am curious, if you're comfortable sharing, are there like top 5 or 10 foods that tend to be reflux triggers?
Yeah, absolutely. And we know from research there are a certain set of foods that can increase someone's risk of reflux. And they're reflux triggers for actually different reasons. So caffeine and alcohol are two beverages that can temporarily loosen that muscle, the lower esophageal sphincter, that is supposed to protect the esophagus. Things like lemon juice, vinegar, acidic beverages. If you think about your tissue, if it's irritated, if you have esophagitis or gastritis, putting acidic things on this tissue that's irritated already can be painful. It's almost like putting like lemon juice in a wound or something like that. So that can be irritating to tissues, but also can stimulate gastric acid secretions. Similarly with spicy foods don't feel good on irritated tissues, but they also stimulate gastric acid secretions. And then when we're thinking about things like chocolate, that has theobromine in it, so that can loosen the sphincter. And garlic and onion also do contain compounds that can loosen the lower esophageal sphincter. So carbonation is another one. Carbonation puts excess pressure on the stomach, and that can loosen the lower esophageal sphincter as well. So it may not be like you need 100% elimination of all of the reflux triggers, but we might be reducing portion size significantly when someone is kind of in a healing phase based on what their tissues look like.
Love it. Awesome. Thank you. That's a great list. None of them really surprising. What about,
Right.
I hear like dairy and chocolate a lot.
Yeah, so chocolate is one of those things that has theobromine in it, and
Okay.
that can loosen the lower esophageal sphincter. It's also high in fat.
Yeah.
And I don't want to demonize fat, because what happens so often is people think, oh, fat's a reflux trigger,
Mhm.
I'll eliminate it. And then we're in a whole host of other problems and
Mhm.
probably a lot of hormonal dysfunction if we're not eating enough fat.
Yeah.
But we do want to spread fat out throughout the day. Like we want to be careful about eating too much fat at one time. And certain meals like that could seem really healthy, like a salad with an olive oil dressing and avocado and nuts and seeds and cheese.
Yeah.
That could be really like lots of healthy foods, but a ton of fat at that meal,
Really?
and that can cause reflux. So we want to just be kind of mindful of that, and that's the reason that dairy is noted as a reflux trigger. Like dairy in and of itself is not a reflux trigger, but high fat things are, and oftentimes dairy can be high fat. So we may be looking at some lower fat options or just kind of limiting portion size a little bit. And then lactose, the sugar in dairy, is a reflux trigger if someone has a lactose intolerance. So we do want to make sure that we're kind of assessing for intolerances. You can get tested for that, or you can kind of be diagnosed based on symptoms, but lactose intolerance can be a hidden root cause of reflux.
Okay, awesome. That was super helpful. I know that dairy, it's one of those foods where, yeah, we don't have necessarily the literature to suggest that it's inflammatory for people with endometriosis, but it's definitely something that a lot of people just, from doing a quick Google search will immediately pull out of their diet. So I'm happy to hear that. That's actually very interesting. Okay, so I know with this question, there's naturally going to be a lot of nuance. Everybody is different. Everybody's cause for why they're getting these symptoms is likely a little bit different as well. And I know we've already kind of talked about the importance of the basics and the foundations, sleep and stress management and nutrition and sort of your meal hygiene, how you're eating, how quickly, if you're eating in a hurry, if you're eating seated, distracted. So with the caveat that, all of those things are your foundation, like don't neglect those. It's really, really important to kind of hammer all those out and do them well. Do you have things, recommendations that you're making in practice that you seem to be recommending kind of on repeat? They're very helpful, or you're just finding that they do apply to like a wider group of people who struggle with these symptoms? So basically, I'm just asking like your top diet, nutrition, lifestyle, if there are supplements that can be helpful and that's something you're comfortable sharing. What are those some of those top recommendations?
Once someone has really dialed in like the nutrition strategies, adequate fiber, adequate fruits and vegetables, lean proteins, and kind of the meal timing and the mealtime hygiene, we're also looking at nervous system regulation as a really important part of their protocol. So things like diaphragmatic breathing actually can help tone the lower esophageal sphincter. There's randomized controlled trials on this, that diaphragmatic breathing after a meal can help close that sphincter. And so we are using diaphragmatic breathing post-meal. Depending on the person, we might use it even more pre-meal or in between work tasks, things like that. But we want to help our clients find like what is going to help them successfully manage stress and regulate the nervous system. Because what we're kind of trying to develop is this feeling of safety in the body. When someone has dealt with health issues, we often lose our ability to feel safe in our body and almost the ability to trust our body. So this might look different person to person. Maybe it looks like playing guitar for 30 minutes a day, or going for a walk after work, or going back to dance classes. Like it's not always a meditation or breathing. These things are amazing. And we talk about them all the time. We have them on the Flora app. But when we want to regulate the nervous system, and if someone especially has esophageal hypersensitivity, we might get a little bit more creative with what nervous system looks like for that person. But it's essentially like making a promise to yourself and then following through on that promise to practice that self-care. And then this act of like following through on that promise, that's building your trust muscle back up with yourself. So we're setting these like realistic goals, realistic things that can help someone help support their nervous system. And then when we're able to follow through, it's also kind of building self-trust. So it goes a little bit deeper than even just, nutrition and supplements. Like we're really trying to also rewire mindset about reflux. Reflux and endo can be really scary. And so we want to learn to, experience a symptom and not let this become a spiral of I'm never going to get better. All my progress is lost. I'll be this way forever. We are trying to kind of rewire the mindset of I have tools. I know what to do. And I know that this isn't going to last forever. I know the way I feel now isn't going to be the way I feel forever. So mindset is really important because if we let ourselves spiral, it regulates our nervous system, dysregulates our nervous system further. And that is going to hinder progress. So we're working on mindset for sure. And then when it comes to supplements, I really love alginate therapy. The one I love the most is Reflux Raft. This is that little algae raft that sits at the top of the stomach and can prevent reflux. Really, really helpful for those with reflux, gastritis, LPR, hiatal hernia, and GERD, of course. I also love mucilaginous herbs. So things like slippery elm, DGL, we're using a lot of those. And I actually am working on a custom supplement that is going to come out soon that will have mucilaginous herbs in it. It will have zinc carnosine as well. Zinc can be really helpful in terms of tissue repair, intestinal permeability. And we also do use or other things like melatonin. Melatonin can help to tone the lower esophageal sphincter at night. Really helpful for those, especially weaning off of PPI. So that's really great. Good research behind melatonin. And then it really depends on the root cause of the reflux. Like if someone's dealing with SIBO, if they're dealing with slow gastric emptying, we might be using a variety of things. But those are kind of some of our go-tos.
Love it. I love that you said melatonin, because melatonin is probably one of the supplements we have the most research for pain symptoms with endometriosis, pain with intercourse, pain with passing stools or urination. Like it's probably one of the most strongly researched supplement supports for endometriosis population. So that's really interesting. So it's like a 2-in-1 if you're somebody who has endo and you're dealing with the reflux symptoms. Really interesting. Great. And I love zinc carnosine too. Actually, it's a really, really good one. Yeah, those are some really, really good tips. I love it. Awesome. Well, those are the questions I had for you. Did you have any last minute final thoughts that you can share with our listeners?
I think that both endo and reflux disorders can be really isolating and scary. And so I definitely recommend, reaching out for support, because we don't want to be kind of leaning on Tums, leaning on NSAIDs all the time, because it can worsen this issue. And I think a big barrier for people actually like getting one-on-one support or reaching out for help can be, number one, not thinking it's going to work, or number two, financial limitations. And those are definitely real barriers. But we also want to think about like the time and energy spent on these issues. And so I would definitely recommend, reaching out for help if you need it. And then I would think about, tuning in with your cycle and thinking, how can I support myself a little bit more this week? Is it going to be with more nervous system support this week before my cycle? Or whatever week you find you have an increase in digestive symptoms, increase in reflux symptoms, how am I going to support myself? Am I going to use alginates? Am I going to sleep elevated, eat an earlier dinner, do some meal prep on a Sunday so that I can eat an earlier dinner and consistently get the fruits and vegetables and protein that my body needs? So I think it comes down to thoughtfulness, a little bit of planning, asking for support when you need it, and knowing that there are so many strategies out there that maybe you necessarily haven't tried, or if you have tried, sometimes maybe we didn't try them long enough. Yeah. And so these things like healing or supporting your body with your hormones, it doesn't happen overnight. So be patient with your body. Remember that it's not Amazon Prime, and we have to be patient and sometimes, stay consistent long enough to see results.
Yeah. I love it. I think that was a beautiful way. I'd love to add a bunch, but I tend to go down rabbit holes. And I think that was a beautiful way to end off our interview. So thanks so much for agreeing to chat with me. And I hope that everybody watching enjoyed the interview. So thanks so much, Molly.
Thank you.
Thank you so much for watching today's video. Again, please don't forget to hit that subscribe button, and we'll see you in the next video.